In 1965, Congress enacted the Older Americans Act, which established the U.S. Administration on Aging and state agencies on aging to address the social services needs of older people. Its mission is broad: to help older people maintain maximum independence in their homes and communities, and to promote a continuum of care for the vulnerable elderly. Considering the broad sweep of services included in its mission, the Act's reach is constrained by modest resources. The Act authorizes 7 titles that include a series of formula-based and discretionary grants. 71% of the funding supports Title III state and community grants for multiple social service programs. Title III authorizes funds for supportive and nutrition services, family caregiver support, and disease prevention and health promotion activities. State agencies are required to pass Title III funds to area agencies to administer within their state-defined planning and service areas. Title III services are available to all people age 60 and over, but they are targeted to those with the greatest economic or social need. Participants are encouraged to make voluntary contributions for services they receive. However, people must not be denied services due to failure to make voluntary contributions or cost-sharing payments. Due to limited funding, a relatively small portion of the older population receives Title III funded services. On December 13, 1976, Hunt County saw the beginning of an agency that almost 40 years later is known as the Senior Center Resources and Public Transit, or the Connection. The original agency was known as the Hunt County Committee on Aging, or HCCA, and it began the work of feeding the elderly of the county who could not be assured of consistent meals without its help. Its first director was Lewis Marshall. HCCA was located at 3720 O'Neill in the donated Greenville Surgical Hospital. In 1989, the agency added the Connection Public Transit Division to assist all persons in our area with their transportation needs. A name change was needed to raise awareness of its services, so on April 14, 2005, the Hunt County Committee on Aging would now be known as Senior Center Resources and Public Transit. The increasing demand for meals, and additionally transportation, saw the opening of its current modern facility at 4912 Lee Street in May of 2008. The current executive director of the Senior Center Resources and Public Transit is Danny Allenbaugh. Nutrition and supportive aging services are provided by the Senior Center Resources and Public Transit in coordination with Area Agency on Aging under Title III of the Older Americans Act. These services are aimed at enhancing overall quality of life while assisting seniors to remain independent and reduce institutionalization. Citizens age 60 and older are eligible for services with priority given to low-income and minority residents of Hunt County. These include congregate meals, which are served at the various senior centers, and everyone in the community is invited. If you are 60 years of age and older, a donation is requested. If you are 59 years of age and under, you would be asked to pay the actual meal cost. We also offer home-delivered meals, homemaker services, telephone reassurance, caregiver education and training, and transportation supplied by the Connection. The Connection, a state-designated rural transit district, provides curb-to-curb transportation to nutrition sites, medical appointments, essential shopping, groceries, prescriptions, and senior centers, offering subsidized and or discount services for seniors, handicapped, and low-income residents. The Connection reservation-based public transit service is also available to all Hunt County residents. Senior Center Resources and Public Transit is granted funding from the North Central Texas Council of Governments, local municipalities, and donations. Unfortunately, our funding does not cover all of the cost of providing services to all the senior citizens of Hunt County. Donations from our community and partners help us in sustaining our goals, preventing institutionalization and neglect. We also receive imperative help from volunteers who distribute home-delivered meals to homebound clients on a predetermined route in Hunt County. To give you an idea of the scope covered by the Senior Center resources and public transit, let's take a look at a couple of items. First, meals. In the year 2014, the total meals served and or delivered was 137,000. On a monthly breakdown, that translates to an average of 10 to 12,000 meals per month. Now for 2015, we're projecting the total meals served and delivered to be 143,800. And that works out to about 11,500 to 12,600 meals per month. And the average cost per each meal is $5.50. The other item to look at is public transit. In 2014, the center provided 64,250 rides for elderly and others with needs. In 2015, we're projecting a total ride number of 69,100. Now currently, SCRPT, that's the senior center, has 17 vehicles for public transit and 5 vehicles for Meals on Wheels, covering a land area of approximately 840 square miles with a population of about 89,000 people. The purchase cost for one of the large buses that provide such rides is $75,000 to $80,000. Services are available at 3 senior centers in Hunt County and through a variety of home-based programs. Center services include congregate meals and recreational activities. With everything we've shared, we'd like to end with what is probably our most important aspect, our mission statement. And that is to impact effectively the communities within our service area by the provision of efficient services to accommodate developmental and economic growth with a respect for the environment, good health, and independence.